Hi, my name is Samuela Medina, and this is my application for the University of Wyoming. So, to describe a meaningful experience or difficult situation, I chose one related to my personal life, and I'll discuss how this experience exemplifies my ambition and enthusiasm to learn. I would say one of the most meaningful experiences in my life was hearing about my mother's childbirth experience. I wasn't there to see it or anything like that because I was the last and the youngest child, but she had one premature baby, which was me, and one overdue baby, which was my sister. And both times we nearly lost our lives due to the lack of proper care at the hospital. I remember I was a premature baby and she went to the doctor, she felt something wasn't right, and she had lost all her amniotic fluid. This also created a divide with my parents because I can only imagine how hard it is to watch two of your kids almost die at a hospital without getting the proper medical care. And I feel like this just made me more empathetic for healthcare workers and the healthcare system. Because even though we didn't have the proper medical care per se, it was still essential for us to live. It kind of made me realize how critical healthcare professionals are and how the quality of care can determine life or death. I became passionate about understanding the medical field and learning how I can make a difference. I started researching the impact of climate change on healthcare, realizing that extreme temperatures, air quality issues, natural disasters, heavy rainfall or drought that can create even more barriers to get adequate medical care. These factors all contribute to higher risks for pregnant women and many other vulnerable populations, like homeless people in poor communities, third world countries, etc. Climate events have the potential to disrupt public health infrastructure and even overwhelm healthcare workers. This experience, I think, fueled my ambition to pursue nursing because I want to be able to provide high quality care to those in need and advocate for better healthcare policies, educate others on the importance of sustainability in medicine, how to really take care of pregnant women or elderly. So now, why is nursing profession for me? And how do my personal values align with professional nursing values? I would say nursing is the profession for me because I personally witnessed the urgent need for compassionate and skilled healthcare professionals. I've lived in Ecuador and New York, and then I moved to Cody. And I still have family in Ecuador and New York, and I've seen firsthand how a lack of healthcare infrastructure prevents many people from receiving the treatment that they need, especially in Ecuador being a healthcare country. Many homeless people, a lot of high crime statistics, and that's statistics too. It came from not being able to receive the treatment that they needed. The challenges faced by those underserved communities inspired me to become a nurse so that I can provide care and advocate for change and contribute to improving healthcare accessibility. After moving to New York, I witnessed better healthcare, but still, there's certain parts in New York where there's not very great medical treatment or access to it because there's poor communities and then there's very wealthy communities like Long Island, even upstate Manhattan. But it's completely different from Ecuador. Ecuador was just crazy to see how understaffed and how in need they are for a change in their medical system. Additionally, I am deeply concerned about how climate change impacts health, from the spread of diseases to the overwhelming of healthcare systems due to extreme weather events, as I mentioned, for climate change. And as a nurse, I want to advocate for sustainability in hospitals and promote solutions like reducing carbon footprint, using renewable energy to create climate smart medical facilities, hospitals, solar panels, stuff like that. Obviously, I feel like that would be very hard coming from a nurse, and especially in our day and age, we keep using more and more carbon footprint. But there's lots of people that are willing to innovate and use renewable energy to create a better world. Climate change, it's always been there in our earth, and it keeps going higher. And I think using renewable energy and getting that sustainability would be incredibly helpful to us. My values, I would say, are definitely my family, my friends, being compassionate, kind. And I think those do align with the core values of nursing. I feel like nursing emphasizes compassion, advocacy, and service to people. My sister is also currently a student at UW, and I've always looked up for her. She is my older sister. She's majoring in civil engineering currently, and she's planning on making a huge difference in the world. She witnessed the water pollution in Ecuador too and wants to help people out there as well by making something that would help them out. It is only climate change affecting humans and their care. There are a million other factors we need to look at. Diseases like COVID-19, how spread how quickly that spread. And I think as a nurse, one of the biggest groups of the healthcare, I think it's important to look and see any ways that we can help out, not just with climate change, but so many of the other factors. The field of nursing consists of working with healthcare team members from a variety of backgrounds and experiences. Describe a time when you worked as a part of an integral team and how did this enhance the functioning of that team. So throughout middle school and high school, I've participated in mostly indoor and outdoor track. I'm doing soccer this year. I did Model UN my sophomore year and internships at Cody Regional Health last year and this year. At Cody Regional Health, I was able to rotate through various departments and see how all the healthcare personnel worked together and communicated to help the patients. These experiences taught me how to collaborate with people from diverse backgrounds and skill sets, especially at Model UN. At Model UN, it's in Jackson Hole, and we're each a different country. We each have our own essays and the problems in our country. I was Brazil, and I remember there was China, and countries like that. And at first I was very shy. It was my very first time doing Model UN, but there were people that were encouraging. You're supposed to talk out and tell people the problems in your country, and then at the end work together to make a solution. And it's incredibly hard to come to an agreement, especially with the countries having different policies, the countries having things they think are a top priority or not, but being able to work together as a team and communicate through that to have a solution, I think was an incredible experience. And I think it really helped me work more of a team, especially for soccer. I think that'll be really, really useful. One of the most valuable lessons I learned during my outdoor track season and indoor, our hurdle team, I focus more on hurdles. We all had different levels of experience. There were freshmen, people that just haven't done it before and want to try it out. I've done hurdles since I was in 7th grade, so I obviously knew what to expect, the drills I needed to do to get better. And some people just needed to do back to the basics, and it was really hard to communicate and find that in between so that we were all helped and felt that we were getting better during practice. So there was a lot of frustration, but instead of letting those differences divide us, we communicated with our coach. We made a group chat. We did workouts together, and sometimes we would split up. So the more advanced people would do their own workout, and the other people would go back to the basics and work on what they needed to do. I feel like this teamwork allowed us to function more effectively on the field and perform our best during our meets. And similarly, during my hospital internship at Cody Regional Health, I observed how nurses, doctors, surgeons, specialists, orthopedics, pediatrics, they all work together to provide a comprehensive care for their patients. And I think it just reinforced the importance that communication has and collaboration, which I think is going to be incredibly essential for nursing because, we do look more closely at the patients, we help the doctors out, and that is really helpful to get them the right care that they need. Describe a time when I did not agree with a decision made by a boss, parent, teacher, or coach. How did I approach it, and what was the outcome? I have many times when I didn't agree with a parent, teacher, or coach, but this one for me was the scariest, and I think it taught me a lot. But last year I started working at Walmart after outdoor track season, and I got hired as an online grocery shopper over the summer. There was a really challenging situation I faced with a team lead. His name was Ethan. It was the 4th of July. One of our managers had called out, and we were a little understaffed on the other departments, and many workers were left with nothing to do. Ethan suggested that we focus only on facing the shelves, which is fixing the items on the shelves and making them look pretty and moving them to the front. But I remembered that our team lead, Jackie, last week had asked us to focus on stocking the shelves and handling overstock with the carts. So I knew that we had to find a way to do that, especially since we have that free time, because usually when it's super busy, we're never allowed to really focus on anything else other than our orders. And we don't have many overnight workers or stockers. So it was kind of our job to be able to focus on that and do that. I explained it to Ethan, and he didn't really agree with me, but it was also a very stressful environment because we knew that the next day there would be lots of people ordering and lots of people coming into the store, and we probably wouldn't have enough items on the shelves. So he also knew that it was important, but it was just very stressful for him to have that many workers. And, I was a new worker, and he's having me tell him what to do. But I went back and approached it calmly. I talked to him. I reminded him about Jackie, and so We came to a conclusion and we decided to split the tasks. Half the team was facing shelves and half working on the carts and stocking. In the end, it was really the right decision because we were able to keep everything running smoothly. The next day, like we expected, there was lots of orders and lots of people coming in, but we were pretty stocked up. And I think this experience taught me the importance of standing up for what I think is right, even when it's intimidating, and find a compromise that benefits the team. I feel like with nursing, there's going to be lots of patients that think they're going to be right, but as a nurse or as a doctor, you want to advocate for them and help them see that that's not exactly what will be the best for them. Lastly, in life, we are faced with situations where we don't feel a strong sense of confidence or we question our own abilities. As a nurse, I will be faced with such situations. So describe a time when you were faced with a situation that challenged your confidence and sense of assurance. I would say there are two big experiences in that. The first one, this definitely challenged my confidence, especially going into the medical field and being a senior and having all the stress about college and scholarships and what career I'm going to be, what the future is going to look like. And it was my first internship at Cody Regional Health because I do it this year too. But we rotated through the departments, and as I watched all these doctors, I was in the acute care center, the long-term care center, orthopedics, pediatrics. I even got to watch surgeries, a knee replacement, hip replacement, getting a thyroid taken out, the cancer center, all these things. It was just a really fast-paced environment, and the nurses and the doctors, they had a lot of extensive knowledge about their patients and what they were doing, and seeing everything up close was a completely new experience. And it was scary to think about having to deal with the patients and them witnessing death, me witnessing death, how I'm going to react, the mistakes you could make. It's an endless, I got myself into an endless loop of those thoughts. But, I started questioning whether I was capable of pursuing a career in nursing after having all those doubts. But I started talking to the professionals, the doctors, the nurses. I started asking them questions, and allowing myself to absorb the environment of the healthcare center is the best advice they could give me. I just started to realize how incredible it was to see the work that they do for others and how they're able to work that quick during a moment of stress or emergency. I even got to watch them down at the ER and them coming in and then being able to make those decisions in that little amount of time to save a life. It's just incredible. This experience also solidified my want to pursue something in the medical field. And I have an aunt that is a nurse and she completely loves her job. She was a travel nurse, and I've also talked to her too. And I'm even doing the internship again, like I said, this semester to continue learning and growing in this environment, especially now that I know what to expect. I have new questions to ask them, and I think it'll be better for me to be able to see what it's like to be in that environment again. And then the other experience I had that tested my confidence and my abilities quite a bit was during an indoor meet in Gillette, my junior year. I was warming up for my hurdle race. We usually warm up 30 minutes before so that we can get our blood flowing and, we're able to do what we're supposed to do. So we get our nerves out. And I've done hurdles since 7th grade, but during that one meet, there was a lot of nervousness. It wasn't a huge meet or anything, but there's always a little nerves for me when I'm going to do a race. But we were just warming up. But as I went over the first hurdle, I knew I misstepped. And as I tried to 3-step the second one, I misstepped and I completely fell over, and it shattered my confidence. I was extremely nervous, more than I was even before, because I've never fallen during a warm-up. On a meet day especially, I've never fallen during warm-up or even practices back at the high school, and I certainly did not want to fall in the actual race. My coach, of course, reassured me that I would be fine. My teammates reassured me, but no words could really take away those nerves. In that moment, I wanted nothing to do with the race. I just wanted to scratch it, but I knew that I would truly regret it. I'm not somebody that usually backs out, and I really take pride on myself for doing those hurdles because I want to make my coaches proud, my parents proud, myself proud, and I've worked so hard. So despite of my doubts, I did remind myself of the hard work I put into training for all those years. And like I said, it wasn't a me, but I always want to give my best and set a new personal record. And, I wanted to overcome that fear too. Even if I fell, it would definitely discourage me a little bit more. It would be a little embarrassing, but it wouldn't be the end of the world. I would have another meet next. I would have a week to practice and improve. And it was a learning experience. If it ever happened again, then I would be more prepared. So, I got back up. I did my warm ups again. I did end up falling. I was nervous. And when it was my turn to go race, I stepped into the blocks, getting my ready position. My heart was racing. They called set and then they called go, and I knew I had to give it my all. I didn't end up three stepping because I was still a little nervous. Three stepping is the goal for hurdlers, but I didn't fall. I even achieved a new PR, not by a long shot, but a PR is incredible no matter what. It's a personal best. This experience taught me that facing fears and setbacks, it's all about your mentality. We all make mistakes, but the key is learning from them. I know that as a nurse, the challenges I will face will be much tougher, but I am confident that I can learn along the way and continue to grow, just as I have in every other difficult situation in my life. I am excited to become or pursue this nursing career. Thank you.